anybody have any public comments that are not already on the agenda that they would like to speak to? Do it when you get up there, just tell us who you are so we can get that down.
Okay, Sarah Walsh with Anchor Health. I have our brochures for the Anchor Rehabilitation Center. We had our open house on Monday. And we had a lot of attendance from the college, Adventist Health, and can you start over?
No, it's so the stream can hear.
Okay. And so I just wanted to know that we expect to be open within a couple weeks. We're still waiting to get fully staffed, and that's the only holdup at the moment.
Okay. Thank you.
How many people do you still need to hire?
Right now, we're looking at filling LVN staffing. We had to go through a hiring agency because we didn't get much luck with local. So we're in the process of finishing that up, and then I think once we get enough LVNs, then we'll be good to go.
Thank you.
Sure.
Okay, I see a familiar face.
Good morning, everybody. Brian Erickson, with Office Recommend Services. And normally I come up and I talk about the number of people we served, and it's great. We are over 1,000 people in all of our programs, as you know. But I actually wanted to talk more about the wonderful work that our staff are doing. One of the ways that we measure that, other than the outcomes that we're showing, is by asking our clients, getting their voice as to how we're doing. This week we're in the middle of completing our client survey that we do every year internally. And although the week is not up, we have had over 100% increase in client participation in that survey. And the results have been astonishing, actually. It really speaks to the work that's being done by our staff, the amazing things that they're doing in changing people's lives. Pardon me. Just one of the standouts, just from, we're almost a whole week into the survey, from the results, 100% increase in participation, 65% of those who responded on overall satisfaction stated that they were a 10 out of 10. It jumps to 83%, say 9 or 10 for overall satisfaction, and 92%, 8, 9, or 10 on their overall satisfaction. It really goes to show that not only are we doing volume, but we're doing quality work and really making a change in people's lives. So it's really humbling to get that feedback and know that everyone is doing such an amazing job. I just wanted to share that with you.
Ryan, I've got a question for you.
Yes, ma'am.
Every time, call me ma'am again.
Sorry.
Uh-oh. You always are giving us numbers and outcomes, but you don't really share what you're doing, and so maybe the next time you're on the agenda, and it wouldn't just be public comment. Next time you're on the agenda, maybe you just give us a little more information about what you're doing and where. And
I would love to do that.
okay, that would be really great, because the numbers are wonderful, but you know, it doesn't tell us what you're doing and how it's.
And maybe what we can do is we can also bring in a couple of people who have had services and they can share their stories.
Well, there's that too, but I also would like to hear it from you. Putting you on the spot.
I'll love to share it.
Okay, thank you.
Anything else? Thank you.
Thanks.
Okay, anybody else? All right. We need to, did anybody go through the minutes from our last meeting? And if so, were there any edits or changes, or can I hear any, or do I have a motion to approve the minutes?
I can make a motion to approve the minutes.
Oh, somebody new? Okay. All righty.
And Jen is online, just to make sure.
Oh.
She's here.
Hey, Jen.
Hi.
Okay. Thank you for being here.
Yeah, thanks for speaking to me.
All right. Okay. have an approval. Any comments or anything more on the agenda? So, Anthony? Yes, no?
Yes.
Okay, I'm sorry. Yes for me. Jen, I don't know if you heard what we're doing yet.
Yeah, I'd say yes for me too.
Okay, thank you. Denise?
Yes.
Tim?
Yes.
Martin? Did we lose him? I know. They're going down to LA, so. Yeah, they headed down to my family. Okay. All right, so that was unanimous, we passed that. We have the number all right already because Jen and Martin just changed places. Okay, I have next that we're going to hear from Redwood Community Services.
Joe, is it possible to take Angie first? We have a 10:30 with the state, and she has to.
Oh, yeah, of
participate
course.
For like an hour, and so we were gonna have to try and take her off and on the call. So
Okay,
if she can just do her report first. Yeah.
Hi, my name's Angie, I'm SUDT manager. Kind of new to this, so bear with me. A little bit about our program, it's an outpatient program. We do outpatient and intakes of outpatient. And we have 3 facilities, Ukiah, Willits, and Fort Bragg. Right now, the intakes are kind of like a little bit like this. They've been on the climb, and the counselors have been really spinning, which is good. We help the clients see what level of treatment they may need as far as the level of care, whether they need to be an outpatient, intensive outpatient, or they need to go to residential. And then we go ahead and help them find, if they don't meet criteria to be at outpatient level, we help them find a residential program, which sometimes is a challenge because it becomes wait lists. So I wish there were more treatment programs, but lots of times there's wait lists, and so then we have to work with the clients around calling and keeping on the wait list to get the bed. So that's been somewhat of a challenge. If they're needing MAT, we also help refer them out for MAT, which is medically assisted treatment, which is Suboxone or Methadone or naltrexone or Sublocade, kind of depends. So we help them connect to that too, because we don't want anyone to suffer. We don't, if they're waiting for detox or they're waiting for residential, we don't want them to be in any kind of a medical detox state, which some of them have to go to the hospital for a medical detox. We have groups, individuals, and we have a couple of working, we call them working group groups, and working group testing, so that people that are working can attend groups and still be tested and not feel like they have to put their job at risk to try to complete the program. And we have childcare, we have a perinatal program in Ukiah, and so moms or dads that have children, we have childcare and we have groups for them and transport them, the women and children, if they need rides, we do that as well. Is there any questions? If I've forgotten anything, no.
Can you share a little bit about how people get referred to your program, whether it's voluntary or whether they get referrals from other places so that people know how people can access services?
So a client can walk right up to the front reception and they'll get an appointment card. They can either call the counselor or leave their number and the counselor will call them. Sometimes if there's a counselor that's available, they can see them then, but lots of times between groups and individuals, what we do is schedule them. So they can be walk-in, they can be referred from public defenders or any of the legal peeps, social services, probation. There's a variety of ways, and they can send in referrals through email. They can call them in. There's no wrong way. There just isn't. There used to be, if you don't have a referral, you need to get the referral, and it becomes hard for them. That's not the way we do it. We have tracking mechanisms that it helps us keep them on a spreadsheet on where they came from, but they can walk right in. And sometimes it's really hard when they come and they don't know which program, because and I'm glad you asked that question. They'll be referred from the courts. They won't have a referral. They won't know if they're mental health diversion, behavioral health court, adult drug court, family dependency court, and they're standing there and they're like, they just want help. So we usually will they call me up usually, and I'll help them figure out whether they're Prop 36, mental health diversion. There's all these different programs that they come in and they stand at the counter and they know they need to sign up, but they don't know for what. So if the staff up front is confused, they call me up and I'll go up and help them figure out whether, what is your paperwork, can you remember what your paperwork has on it? Can you go home and send me a picture? So I had somebody that is 11395, which is which is a Prop 36 client. He thought he was BHC. That's different. So he sent it to me. We got him scheduled, and he's going to come and see me. So there is no wrong way. We have families call. I've got my child, son, daughter, grandchild that's having problems, and we have different counselors that we will schedule in with. There's no wrong way. I try to put that out at the other meetings that I attend to, because some people think if there's no paper, you're not getting anywhere. I don't want that to be a burden for anybody.
Thank you.
You're welcome. Anyone else? Thank you.
Thank you.
I think I have a dead microphone over here. Yours? Yeah. It wasn't just me. Thank you. All righty. Why don't we try RCS again, Redwood Community Services?
Good morning. So on our SEDS programming, some updates. Actually, we are excited. I don't know if excited is always the right word when people are entering treatment, but just an overview. We have a residential, perinatal, non-perinatal residential for mothers, women, and their children if they have them. In Lake County, we're a partnership provider, but we also have a separate contract with Mendocino County, but also can serve Mendocino County through our partnership contract. We have 2 women, Mendocino County women, entering today. So we are, again, that's why I say, it's good to have the access to residential treatment for moms. One of the unique aspects for Thule House is that we accept children in with moms. We have a certain number of slots, and so if we're at capacity, we can't, but if at all possible, we accept children in with moms. So we integrate a enriched program for parenting and parenting support and education, as well as their substance use treatment, which I think goes a long way into supporting them into the outpatient programming, and supports children not being in either foster care and or kin care while moms are in treatment. And it's more unique than most perinatal programs, perinatal residential. We also have an outpatient program in Lake County that we offer for Lake County beneficiaries, but we do that, perinatal outpatient. If anybody is outside of Lake County and is in Thule House for residential, we then refer to outpatient. So for instance, our Mendocino County beneficiaries coming into Thule, then we would be coordinating care when they graduate and discharge from Thule to the outpatient program that was just discussed. We also have, we have a license and certification for outpatient here in Mendocino County as well. There has been ups and downs with workforce. Actually, SEDS counseling is one of, there's workforce shortages all over the place, but this counselor and RAD-T is a significant workforce shortage throughout the state, and so we have had people come in and then need to be moved over to other programs and do, and so it's been a challenge to get consistent staffing, but we're excited that we believe in the next month or 2 we'll be able to open that fully again. We do have youth identified at the Arbor for youth groups right now, and we have then community-based outpatient options once we have this staff. So it will be another avenue for people to get outpatient substance use treatment here in Mendocino County. So that's my update. I unfortunately, I'm sorry, I don't have my full report with success stories and data this month. I was running around the last 2 days and haven't even sat at my desk, so I apologize. I can forward that for to Rosanna for your review afterwards, if that's okay.
I would rather have you helping people.
Well, been a couple of wild days, but I appreciate your
Thank you.
flexibility.
Any other questions? Thanks. New microphone? Is somebody here from that? All right. Okay, then I see other people out here. No other reports. So am I missing somebody? Then can we go on to Dr. Miller's report?
All right, the director's report is in your agenda. If there are any questions, I can answer those. Also, if there are any things you guys want to see on there, we can always add to it, but we're always going to add more information if there's something else you guys want to see. You can see the updated pictures of the psychiatric health facility. It is really coming along, so we're super excited about that. And obviously we've been working with ResCap on getting ready to open as soon as the building is finalized and ready to go. So we'll probably hear more about that in Measure B today and Measure B after this. So you'll probably an update from facilities on that. We're continuing to watch the federal changes and both the federal and state changes regarding funding. There is a lot going on right now. Obviously, a lot around the mobile crisis, being able to go Medi-Cal and getting fully reimbursed, which the trailer bill right now is out, would make it optional for counties to continue to operate mobile crisis units in their counties as of April 1st. There's a lot of lobbying going on to try to see what options we have to keep those funded for counties who may want to keep it funded. It is hard for some of the really rural counties to operate those mobile teams, and so I think there are some counties who would prefer that it become a voluntary option. We have small counties like Woodrow, and different small counties where it's not always viable to have a 24/7 team operating. There's also conversations where we're talking about would there be another model we would present that was a local crisis focus. And so there's a lot of talk with our governing bodies about how we could propose this and what this would look like, how it would look differently. A lot still happening. We continue to watch grants and funding and seeing the changes. If there are going to be changes, we're still waiting to know what the full FMAP changes could be. That was the big thing with mobile crisis, was the feds changing from an 85% reimbursement to a 50% reimbursement for the FMAP. And so we're continuing to watch that. We also are preparing for this next fiscal year where we will be moving into BHSA, away from MHSA into BHSA, which means that some of the FSP, some of the mental health MHSA dollars we had to use as Medi-Cal match are not going to be there at the level they were. They're going to have to really be focused on our evidence-based services. So we're going to be really looking at how that's going to impact, or if it will impact the system of care when we are having to reduce some of the match dollars we currently have in our system for regular outpatient services. So a lot going on with that. We are finishing up the Mental Health Services Act, Behavioral Health Services Act, RFP. We can't talk about that, but I know Joe is part of that committee. And so more information to come on that. There was two things that we were going to show today. We are working on, we have 5 of your guys' tablets ordered. And so we've been working with IT on getting those set up for the board, and then we have 5 more that we ordered today. So by the next meeting, we should have tablets for everybody who wants to use them while they're at the meeting. And so a part part of that, we've been looking at, there's always a conversation about how do we get the documents that would be beneficial for BHAP members to have. And in the past, we've done, as you guys know, we've done those green binders, and we'd have you guys bring them back in and then reprint them and give them back. And so we've been developing a SharePoint site for all of our boards. We use it with our providers currently, and so they're able to go in and we keep their stuff updated. It's got policies and procedures, it's got their finances up there. They can see where invoices, what's reported, where their invoices are. We're continuing to expand that. So we've decided to expand that to our 3 boards, Public Health, Behavioral Health, and Measure B. And so what you'll see is our SharePoint. We'll be working with you to get on because you have to then get into the county system. So we'll need to get you guys a VPN, which we do with our providers here. And then the plan is, and we can still have paper, and we can still do that. But really the point is to get away from printing as much as we need and not having to redo those binders unless somebody really needs paper. So you guys will be able to come to this link here. If you can see on the TV screen, Dustin has it up. You'll be able to see that there are 3 boards posted there: Behavioral Health Advisory Board, Public Health Advisory Board, and then Measure B. You will only have access to your board. You will see all 3, but you're only going to have access to your board. And so you'll be able to click on the Behavioral Health Advisory Board. That'll bring you into your own kind of internal web page. And then you'll have all your BHAP documents, which Dustin can click on, and we're just putting this together, so we still have some playing to do with it. But you'll see what's in there currently. It currently has your calendar, your best practices from CAL Board, the California Behavioral Health Board. We scanned in their information, your roster. You will be able to get your membership, your bylaws. You'll be able to access everything that you're needed to be that you may need to know as a Behavioral Health Advisory Board member. You'll also have access to prior agenda and minutes. And we'll also have the agenda and minutes in here for you guys. And then if there are other things you think would be beneficial for this board to have access to, we can then load it up there also. And then that really gets us from having to be one paper. It also creates an archive that we can create, so if we want to see old documents, it'll be easy for you guys to go back and see those. And it'll stop from having to bring our binders in and reprint them and put paper in them.
So do you want the binders back? You want to use them again?
No, I don't want the binder back unless you want to give me the binder back. I'm happy to take it back.
It's in the car.
So this is kind of where we're going, and hopeful that the board will find it helpful. We will spend some time helping you guys navigate it and learn it. But I think it'll be nice to have everything you need in one place. Any comments, questions, concerns? Yes, Dawn.
I had a question about the data for this reporting period. It seems like the LPS conservatorships are up a little bit, and maybe also the crisis calls are up a little bit. Is that normal during this time period, or is there anything different happening?
I don't know that I would say it's normal during this time period. I don't think it's, and especially, it's after the holidays. It's not a big time. Usually January's are a little bit slower. I think we are, in regards to LPS, there is a lot of movement for the courts and everybody. I think we're getting a lot of referrals out of our jail system more than we have. And a lot more, what's interesting, a lot more of the psych hospitals are starting to just want to push towards LPS. We've been trying to push back on, have you tried to get a paid care court first? I had a meeting with our judges also to talk about maybe we don't have to go to LPS first. Maybe how do we work? How do we look at looking at care court and AOT? So I'm working with Kim and the judges on trying to come up with a referral form and a better way to look at not everyone coming in for an LPS referral. But there is a lot more requests for LPS than we've ever seen.
Thank you.
Any more questions?
I have one other thing we're going to show you, but I wanted to, any concerns with the SharePoint? Does it sound good?
That sounds good, as long as somebody's, I've never used it, so I would obviously like training.
Yeah, we'll
But I think that's great, because it just saves us so much.
We will get everyone trained, and as soon as, I think it'll be ready by next meeting, right, Dustin, you think?
The SharePoint?
Yeah.
SharePoint's pretty much ready. It's just a matter of getting everybody access. So, yeah.
Will that require us to do a training in a meeting? Is that going to be a separate meeting?
No, we'll probably, we don't have to do that. I think we'll probably work with each of you separately to get you sort of trained, and then what we may have is at the next meeting, we may have our IT person come in, just to make sure that everything's set up and ready to go in case there are additional questions. We might ask Ian to come down as finance team and just make sure that everyone can access it appropriately and there aren't any concerns. And we do realize there may be a training phase, so we realized for a couple months it might be calling, saying, hey, how do you remind me how to get into this? So we'll work with everybody for a couple months to make sure everyone is solid in accessing it. But it will only be for board members that will have access to that. And Mo.
And Mo, is that what you
Yeah,
said?
and Mo.
And what about Bernie?
Oh, yeah, yeah. Mo and Bernie can have access, board, but it's not public, I guess.
Yeah.
All right, the other website, as you know, we've been working on the Good to Know Mendo website. We've talked about it at a variety of different meetings that we're at. Dustin's been working with our FE to do some redesigning of it, and we're trying to get more data on there. What I wanted to show is that we recently added, if you look on the TV screen, you'll see we added a health data page. This is coming from our epidemiologist, and really looking at, this is going to be open to the general public. It's public-wide, but we're really been building out a health dashboard for our county, specific to Mendocino County, so people can see the health outcomes that are trends in Mendocino County. And so this is, I don't think it's completely public yet, right, Dustin? You haven't launched it, did you launch it?
Yeah.
Yeah, it's public now. Okay. So this is pretty common, what you would see for a data dashboard. It's not something we've had in Mendocino County available to the public. You have to go into sort of the state site and manipulate. This is specific to Mendocino County, and it allows you to see a variety of deaths, premature deaths, and then you can go down and you can select whether you want to see it over 1 to 3 years. You can go into specific areas. You can look at it by cause of death, and you can look at it by ethnicity, race, age, and stuff like that. One of the things that we're using this on is how to do some better health outcome information. One of the things you'll see with Mendocino County, I don't know if that's as easy to pull up, but we have high deaths due to chronic liver disease, and it's something that you can go in and you can see where we're higher than the state on where we're doing better than the state average, and where we see a lot more deaths at this than the state of California as an average across all counties. And so we're looking at getting the information obviously out to the public, but also getting the information so it's more things that we can focus on from health outcome preventative measures to look at how we're looking at how we compare to the state of California with everything we're doing for health outcomes. So it's a really nice to have. There's been a lot of ask for some type of dashboard, I think, for several years. And so I've been working with our FE team to get something created. So it is nice that you can see our, number one cause of death in Mendocino County. And then you can see number 2, number 3. So. And you can actually, we did some look at, you can see like where that death is more often occurring, whether it's in like which zip code it's occurring in, like who has the highest number of deaths from cancer. You can see in quite pocketed areas. for whatever disease you want to look at. Yeah, if you look at it, I'd have to play it, but you can actually see us compared to the state. The state's like 14, 14, and ours is like 26. Pretty crazy. We're also going to add some birth rate data and we'll continue to expand the dashboard over the next couple of months with more information on Mendocino County and the health of our community.
Do we have this kind of information on mental health and substance abuse?
Yeah, you can break that down to suicides, and you can break that down, because you'll see suicide is on there. You can break it down to suicides, you can break it down to overdoses. You can see the state average compared to us on suicides and overdoses, yeah.
That seems to just...
Joe, can I say something? So in another meeting that I was in, we had a member of the public come and ask us to have more transportation, public transportation, because of the high risk of DUIs. And I talked to Dr. Miller after that meeting because the quick research that I did showed that we're like top 5 of the most deaths of DUI in the state of California. And I think also this data about liver disease points probably more also to alcohol consumption. And I don't think that as a community we talk often enough about the risks of using alcohol at every age. So I hope that, and I think if this board is interested, it might be a good place to bring in some conversations around alcohol misuse disorder. Is that the correct term? In our community, and especially for young people, but obviously for people of driving age.
This county promotes so much in the way of alcohol. I mean, we've got not only the wine, we've got the beer, we've got the distilleries, and there's, I'm saying plurals. And so it's just part of what we've promoted for years, and I think it's just catching up with us. So, but then at the same time, there seeming to be less of a market for wine. I don't know, but I mean, I don't particularly care to get drunk, but I don't understand myself why people want to be that altered, or what, the cause, the effect, and then of course we're promoting it. It's okay. It's like smoking was. It was supposed to be a good thing, and now it's not.
It's one of the things we're looking at, that why I brought it up is, I've been bringing it up for I think a couple of years about, we talk so much about substance use, and we look at deaths by overdoses. We are not going to, very seldom are you going to have an alcohol overdose death, right? It can happen.
It happens.
It's not in as much as what we see in our stats. And what we don't talk about is excessive alcohol use and the long-term health outcomes and the deaths we're seeing later on. Because usually your death is not immediate, right? It's a long-term chronic illness that happens from, and we don't talk a lot about Korsakoff, right? Which is a horrible disease now. So I do think that there is a need for, whether it's this board or, anything, that we do have to start making sure as we talk about overdoses, that we don't leave out, or substance use, that we don't leave out alcohol. Even if it's socially acceptable, and we do know there's long-term health outcomes related to it that I think we ignore a lot.
So one, the tourism that is supposed to be for the area for consumption, which, you know, we built up with that, well before that, I think, actually, as far as alcohol consumption. And kind of going back historically with at least Fort Bragg, Mendocino area, consumption and, you know, driving have been a thing that's been accepted and kind of just a blind eye turn towards it. We had a police chief that spent a significant amount of time and effort getting so that the police force had the ability to do DUI regulated stops, and be able to test and see, as according to, you know, the laws for arrest and charges. He brought up several more officers that would be able to do it, and funny enough, the amount of arrests in Fort Bragg went up to record levels. They went up to more than we, you know, had ever seen before. And the response, interestingly enough, from people in the community, some people in the community, was that we didn't have a drunk driving problem, but we had a arrest problem. And so this is very interesting. We look at what we have as far as a sort of acceptance of consumption. So it would be something where the most bang for our buck would be trying to get back to the schools where early drinking starts. And we're talking about first year of high school. There's been incidents of alcohol on campus going to middle school. And so to the point where, you know, students would bring alcohol mixed with like cough syrup to class. So we've got our work cut out for us in this. One of the things that, once again, getting, you know, really good return on this is what we would like to see done with the campus officers and what we think would give us the biggest return on that. We used to have, I think it was every 3 minutes was a exercise where they have a car crash that was an actual car crash from somebody who had been driving while intoxicated, and you know, show the results of it, and then they take a certain amount of students out of the classrooms as they went for what was the loss of students, you know, nationally, and kind of drive home with it, you know, what it was supposed to be. We haven't done that in a long time, unfortunately. So there's a lot to look at as far as opportunities and trying to make it so that we have a stronger feel for, you know, underage drinking alone, much less drinking and driving. What we can do to try to make that something that's non-existent as possible, rather than it's accepted that it is in this county.
It's interesting because I had been for 20 years, and that was one of the things we did, wine tastings, cooked and did all that. And we would do, like in Little River for the Whale Festival, we had like a wine trail, and it went from one end of Little River to the other and everything in between. And then we started looking at each other going, well, wait a minute, these people are on the road. And we changed it because we realized we were promoting, without even thinking about it, the drunk driving. And the last place that people stopped would be at the Little River Market, where they would be given coffee and cookies, you know, and it's like, well, that's not quite all we need. So we had to really think about that, because then also the vendors become responsible for the DUIs and the injuries and everything, and liable for all that. But like Jim said, accepted, nobody talks about it.
Yeah, it's from a service industry viewpoint, I'm very happy that you know, even in recent memory, people, my staff, doing refusal of service for people who were obviously under the influence already.
And it was getting tighter and tighter. When we had it open, we had to start putting new posters up at the entrances and so forth, but it still hasn't changed. So is that something that we would want to look at to deal with somehow in this board? Is that under the purview of behavioral health? I'm looking at Dr. Miller.
Yeah, you guys are over mental health and substance use includes alcohol.
So would you think that might be beneficial, that we look, or maybe have, I don't know where would we go, maybe somebody from AA coming in and explaining that and what they find works for people?
We have our substance use teams that can talk about alcohol and what we see, so I think that we have experts even in the county system, and I think, we could work with the coroner to get data on, DUIs and deaths. So when it was remote text me, I actually got a book the next day about, California, of all the deaths due to DUIs across the state, so it's kind of interesting that the book came the day after she brought it up, but, so I think we have data. We can also work with the coroner. We've done that before to get some additional data or see what's coming in. So I think it is up to this board to take it on. I think this is the best board to take it on. And I think it's something that can be beneficial.
Yeah.
Go ahead.
That's okay. I think, CHP doesn't usually come to our meetings, but in Mendocino County, the Sheriff's Office isn't necessarily typically a traffic enforcement agency. So that does come from CHP or the municipal departments like Ukiah, Fort Bragg, police departments. So, I think even having them have a small presentation, but to the point of, groups that can organize or support public outreach activities like the Every 3 Minutes program or other programs. I think it's great that we're about to have a fentanyl overdose of awareness program available, but I also think that in our community we need to be talking about this as well.
I think actually, funny enough, it's going to be the party with alcohol and fentanyl abuse. They're going to go hand in hand, because usually what happens is the party doesn't restrict itself to just one type of drug use. That was a loss of a student in Fort Bragg a year or two ago that was with a party that was supposed to be just drinking, somebody had brought in, counterfeit prescriptions to use, and that's where the fentanyl-laced drugs were shared, and unfortunately one student was not able to be revived after that. I think, as far as awareness for the students, is probably going to be give us the best bang for the buck, but the police departments will be able to probably give us good feedback on that as well. But really, I think that's a great idea. As far as trying to deal with, alcohol abuse on a more grown-up level, that's a tough one. I think, we're talking about the most that we can do as a board would be try to work with a preventative basis, and that would be giving kids while they're young, explaining, this is something legal that you'll be able to enjoy as you, grow up, but understanding that there's a difference between enjoyment and abuse, and trying to establish that early on, because, it's certainly got its own student to it. Seeing how some parents operate with, almost like impunity for irresponsible behavior, it probably enforces the idea that, it's not going to happen to me. That, how would you describe it? Unrealistic optimism.
Yeah. Well, I remember, and I don't know if they still teach it, we had driver's ed classes, and there was that one movie, it was Ancient, Red Cement.
Red
Red Off. And I mean, I remember it, but I came from a home where my parents only drank when they had people over, then they would pull something out. And then there's other families that they drink every night. My father-in-law used to have a Manhattan at 10 in the morning while he was gardening. So I mean, two ends of the spectrum.
Yeah.
So that probably would be something we should look at, because that, when we talk about substance use here, it's usually street drugs. You know, we don't even touch on marijuana. And some people can have a problem with that too. We can do that. The other thing we still need to do is have Blue Bullets police here to just,
Yes, we're gonna talk to Ryan and see
yeah. So, but he can talk to the alcohol thing and start that ball rolling.
Yeah.
Put him on the spot.
I had two other things, so it sounds like we are a yes for the alcohol stuff, so some things we can work on. We are having a fentanyl high movie night, both in Ukiah and in Fort Bragg. We've been working with NCO and Mendocino County Office of Education to put on to movie nights. I think the plan is to potentially extend that if these two events go well. The county did buy the rights to Fentanyl High, the movie Fentanyl High, which was produced by a young man. If no one's seen it, it's a really good documentary that really talks about the impacts of opioids and fentanyl. And so we will be doing that March 25th, right, in Ukiah, and April 2nd in Fort Bragg. We're having it at the movie theaters, so it'll be the movie theater here in Ukiah and the movie theater in Fort Bragg. MCOE is really working with their schools to get information out to all of the parents. To really, the goal is really for parent education, to really get parents familiar and understanding the impacts of opioids and fentanyl. And so we're hoping to see that be successful. We will be getting some flyers out, so we'll get it to you guys once the flyer, so he's working on the flyer that gets created. And so just wanted to let you guys know those two things are coming up.
And the other drug that has hit the street is 5-1K, ketamine. Is there anything on that we have?
Nothing that we have on that. The big thing we've been working on besides fentanyl is kratom. The big thing that's hitting is kratom, and we've been doing some education on kratom. We are still working on the Whippets ban, but we've been doing some education on kratom. The California Department of Public Health has released some information, and I think there was a lot of questions on is kratom legal? And what it is, you know, can you sell it, can you buy it, can you carry it on your person? There's some legislation, I think, going through to look at making kratom illegal, because we are seeing people that are overdosing on it and getting very addictive, and the withdrawals from kratom is severe. And so that's the other one we've been really working on. CDPH did put some letters out about while it's legal to utilize it and have it on your person, it is not legal to sell it or manufacture it. So we've been working through our opioid task force to just reinforce and Safe RX to reinforce that you're not supposed to be selling it or manufacturing it in the state of California. But so that's been the other one we've been really focused on.
Any other questions? Do you have more?
No.
Any other questions for Dr. Miller? Okay. All right.
You want me to?
Yeah, I do.
So, I didn't think about what it was for a minute.
No, the BHAP representative from Measure B
So-
has been me, so, and I.
So we, it is, so BHAP has terms, just like we have on, Measure B has terms, just like you guys have on the Health Advisory Board. This committee has always designated the chair. That was something decided years ago. When Measure B started was to have your chair sit. That term is up and we need to reappoint. So we're bringing it back to the committee for this committee to decide who you want to be your representative. On Measure B, Joe, because she's your chair, is your current representative. And so we need a motion or volunteers who might be interested in serving on Measure B. I believe Joe is interested and would like to continue to serve if you guys would like her. She is the chair this year, so I should note if you decide to step in, you will end up being the chair for Measure B because that seat is the chair this year. So we definitely need to, this committee needs to decide who you want your Measure B rep to be so that she can fill out the application and we can, or he or she, can make sure the seat is re-up for the next, I think, 3-year term.
So I'm willing to still do the job. I really want to see it through, and I've been going to the meetings since before I was ever on that committee, from day one. So it's one of the things that I think this county has really accomplished something really good, despite the negative rhetoric and atmosphere. It's, we've really done something wonderful. And it'll be even better when it grows. But, and it's been utilized. And you're sitting in a room that is Measure B paid for. So do I hear any motions or?
I forcibly nominate Joe Rice.
I surrender.
Okay. So, do I do the roll call?
Do you want me to do it?
Yeah, go for it.
All right.
Kind of awkward.
All right, Anthony,
Yes.
Joe,
Yes.
Mark's not here, Jennifer,
Yes.
okay, Denise? Yes. Tim?
Yes.
Martin?
Depends on how far south they got to
Yeah,
Okay.
this is Mark, yeah.
Okay, thank you.
Thanks, Martin. All right. So, having gone through that, is there anything that I need to take to Measure B this afternoon? Because there is a Measure B meeting this afternoon at 1 o'clock here. Is there anything that anybody needs me to take to them?
And you are bringing 2 things already from this committee, don't forget, just to make sure in case someone asks, but you're bringing the newsletter about whether or not they wanted to participate in that, doing a joint or triple newsletter. And you are bringing forward, I believe, the request for a joint meeting.
Right. There's been so much this month. Sorry. All right, anybody have anything else they would like to see or information from or questions for them?
No.
Okay. All right, going forward. I'm going to committee reports. We have an empty seat on this board, and we are looking to fill it, and we need a couple of people to be a membership committee to go out and beat the bushes, so to speak. Pardon me?
To review the application.
Right.
So what we need to do is, there's 3 seats that are vacant, but one is the district seat, so that seat is appointed by your board, by that board of supervisor. There are 2 community member seats that are vacant, and those have to be, per your bylaws, you create a membership committee of at least 2 members, and you would review all the applications, potentially interview the people, and then make the decision on who would fill those 2 seats. So to follow the bylaws, we need 2 people to agree to be on the membership committee and work with Joe on doing reviewing the applications, interviewing, and then picking who would be the best for to fill those 2 seats.
Anthony?
I can do it, I have that interviewing experience.
A little bit?
Just a tad.
So you want to do it too?
I can do it.
That would be great.
So we'll need to make sure a roll call.
So we will, we need to have a motion to accept them. So do I hear a motion to accept Anthony and Tim as our membership committee?
Excellent.
Okay.
Can you second for ourselves?
Yeah,
You can.
okay. All right. So we shall do a roll call again. Anthony?
Yes.
Joe? Yes. Jen, are you still there?
Yeah, I agree.
Okay. Denise?
Yes.
Tim?
Yes.
Martin? Martin, are you there? I was hearing you. Hello, Martin? Martin, are you there?
Hey, thank you so much. Can you hear me?
Now I do.
Okay.
Did you hear the motion and the?
Yeah, he said.
Okay, all right, thank you. Okay. All right, so you guys are on the spot. It all passed. Thank you very much for doing that. I appreciate it. That was all I had. Mom, you got anything? All righty. Jen, is there anything that you need to tell us?
No.
Okay. Martin?
No, I'm good.
All right. Martin will go forward in the next month or so about getting a plaque for Jeff Ship, if that ends up being necessary, because he may end up deciding to stay on the board.
So I know you guys voted to get a plaque, but we ended up putting it on hold because he may decide to stay.
Yeah. So, all right. Amazing. Anything else that we need to talk about? Are there any member comments? Well, we're a group today.
I wonder if there's any other comments, so some people will join us, but
No?
silent.
I've asked them, at least 2 or 3 times, and they're all sitting there very quiet.
I don't
So,
know if Janine offered after I left that we do have 2 counselors that go into the schools, the United School District. So I forgot to say that earlier. I just wanted to put that out there, everybody, that we are, because I was hearing talks about alcohol, and it is alcohol and marijuana. Nitrous is big. So we do have 2 counselors going into the schools doing education, and we have one that goes into.
is that in the whole county or just?
United, right now it's United School District. We're working at getting back into MCOE. And then we do have a counselor that goes into juvenile hall and does group and individuals with those folks too.
Ukiah.
Yeah,
You gotta unify.
yeah. So that's right. I mean, that's great for Ukiah, but there's also Fort Bragg has.
Fort Bragg has a connection with Coast Clinic, is my understanding, from talking to Lucretia, that there is some stuff happening there, because we're trying to get into Fort Bragg. And I think we've worked with Willits at times, trying to get into Willits.
Okay. And then we always have the South Coast, which is now cut off from the world from the slime that happened this morning.
She does see a few in Willits, but, and sometimes in the outer areas. So it depends on who they're-
It's just, it's so hard because our county is so spread out. And then there's Copelo and there's Piercy. Piercy's the other one that gets forgotten.
And it is true about the schools with ours was, I'm from Cloverdale, so ours was first 15 minutes as far as the accidents and alcohol. And it was so impactful. I mean, even I can remember my daughter coming home in tears. She's 35 now, but I still remember how impactful it was on her and her friends to be a part of that and to witness the rippling impact of it. It's not just having a few drinks at the party.
That's the biggest thing that I see is we have these well-intentioned programs and they tend to sit in Ukiah and they might get up to Willits. Hopland is, I don't even know, the kids that are in Hopland, do they go to Ukiah schools?
They have the schools that
They have through. But then high school, they'd be going up to Ukiah. And they're the same with, I think, Elk, they have grammar school, but there's the high school, they go up to Mendocino. And so we have all these outlying areas and they get missed. And part of it's money and just the immensity of this county. But it's important. I mean, I was thinking, we had been discussing where to have the coastal meeting with Measure B and BHAB. And, you know, Walla has a wonderful meeting center at the Art Center. But nobody's going to want to drive down there. You know, and it's like, we have to do a field trip. But it's how do we do this? So that's why I asked. Thank you. Anything else?
Joe, you could involve your service clubs. Our service club, South Ukiah Rotary, was very involved in every 3 minutes, and one of our Rotarians was the friend we were for years. And we were just talking about that at the Community Service Committee, about what happened to that. And so I think that's something to pursue. Your service clubs are always looking for things to do, and they do care about our kids.
Well, you sit next to the next Rotarian.
I know, I didn't vote me out yet.
Well, I'm on the Community Services Committee for South Ukiah.
Nice, thank you.
So it came up in discussion about the 3 minutes. And so if it's something you want to pursue, to approach the service clubs to participate. Lions is always, they have a whole bunch of different events in Ukiah. So your service clubs might be the ones to approach and each take a piece of it or something. They have small amounts of money they can contribute towards whatever has to be done with it.
Okay. Right. So, anything more? It's like speak now or forever. Do I hear a motion to adjourn?
I'll do
I'll do it.
I'll make a motion.
I'll second it.
All right. Thank you very much. Thank you guys for being here, even if you were quiet.
Thanks, Joe.
Thank you, Jen, for doing that. And thanks, Martin. Drive safely. Please drive safely.